after work, I would have to stay for 2 hours to finish my documentation. I remember doing this on this cold, dark February night, and there's a colleague sitting next to me, and she said something very profound. She said, Rushika, every day I lose a little piece of my soul. Every day a little piece of my soul. The patients come to us with such big needs. We have all this training to try and help them, but I can't help them in the system with 7 minutes and all this crap we have to do. And this was a kicker, it's getting worse and not better.
It is snowballing to a point where almost any part of the healthcare industry, more than half the workforce is feeling burnt out. At least half the workforce is feeling like they're not valued by their organizations.
Our workforce and our community is suffering in ways that in my career I have not seen this kind of distress and pain.
It's not like things were perfect in 2019 and then the pandemic hit in 2020. We knew healthcare was changing up through 2019, so we kind of came in to the pandemic at a time when we thought healthcare was changing, and the pandemic made things spin so fast it almost felt out of control.
If we are going to be able to go forward and continue the quality of care that we want to deliver to our patients and families, we have to look at our workforce and we have to heal it.
The Schwartz Center's Healing Healthcare Initiative will offer healthcare leaders both a compassionate leadership program and a guiding framework to support them as they work to revitalize the healthcare workforce, to build compassionate organizational cultures, and really to envision the kind of transformation that's going to be needed to improve health in the future. The key principles of HHI include the need to really secure physical and psychological safety, the mental health and well-being of the healthcare workforce, as well as their sense of meaning and purpose, a sense of being appreciated and valued. We included diversity and equity, very strong imperative, trustworthiness and transparency, inclusion, voice, and choice in how decisions and policies are made, and finally, team cohesion and collaboration. With the Healing Healthcare Initiative, the goal is ultimately a flourishing healthcare workforce that is enabled by leaders to really envision and provide the kind of care that is relationship-based, compassionate, effective, and safe for everyone, including for the healthcare workforce themselves.
It's very difficult to care for patients when you're not feeling good and taking care of yourself.
And ask yourself as an organization, what is your investment in organizational care? This means you're actually thinking about the organizational structure and the way in which the organizational structure is actually inducing trauma in your staff. And until we get to that layer, caring for the caregivers is like throwing a penny in the ocean. Because if the organization keeps inducing trauma and we create more opportunities for our staff to feel healthier, they collide.
We need to recognize that they're all humans and they're all in need of help and a break because they're all very tired. And to me, what we need to be bringing to the healthcare leadership right now are the tools that really can help them move the needle.
I think leaders are just experiencing inordinate levels of stress. They are not immune. Leaders need healing too, and they need compassion as well. You know, before the pandemic, there was a survey done also that showed that 50% of healthcare leaders surveyed were reporting burnout themselves, and 75% said they knew a leader who had left because of burnout.
We have to continue to have laser focus on what is it that we need to continue to do to improve healthcare, to support our clinicians, to take care of our patients and families, to give our leaders the tools that they need to lead, and that we have to have organizations that are in support of all of those things to continue to make things better.
I think the myth that we've had for years is it's too hard to make big change, let's make little changes, and people have tweaked around the edges, right? Maybe that's wrong. Maybe it's too hard to make little changes. We need to make big changes, and we need to sort of reroute the system. And we need to build systems that focus on relationships and not transactions. And we need to build systems that focus on the human part and let the technology and all these other things play their appropriate role. If we do those things, I think we'll be in great shape. I'm hopeful, as we mentioned, that we are moving in the right direction.
The people that are serving in the healthcare industry got into it for mission. And I think we need to call on that mission to change the very structure. And I think the best way to do that is through compassionate leadership and compassionate care. And that's why I think what the Schwartz Center is doing is so central to this change.
When I think about all that the Schwartz Center is trying to do in terms of their Healing Healthcare initiative, that's what it's all about, is how can we take organizations like the Schwartz Center and the incredible work that they're doing and replicate that across the country and across the world to heal our workforce.
I am optimistic. We've got the momentum. The wind is in our sails, and we are not turning back.